Hello, I'm Dr. Tony Foster, one of the general surgeons here at the Spectrum Health Medical Group. I'm originally from Muskegon, but moved here to Grand Rapids to go to high school and college. I went to Aquinas College for those years, and it was at Aquinas that I met my wife, who was originally from Cleveland, and we decided that Grand Rapids is where we wanted to set up and raise our family. When I was in college, I was actually a philosophy major, and that's kind of a roundabout way to get to working in medicine. But I had been working during summers as a nurse's aide and an orderly, and so got my interest in medicine altogether in the doing side of medicine. I'd always been motivated to want to be helping people, to doing things for people, and I thought that medicine was the way to go. And so I took some courses and realized that I could actually perform well. I took one course where my counselor says, yeah, but you're a philosophy major. You're going to be with all these pre-medical students and pre-dental students. They're pretty heavy duty. I says, yeah, I know, but can I take the course? He says, yes. So at any rate, I found that I was able to perform for the courses, applied to medical school, and I got accepted at Wayne State Medical School where I went. In medical school, I also thought that I was going to be this great diagnostician and internal medicine doctor, but found again the doing side of medicine, the doing side of helping people is really what motivated me and got my juices flowing, so to speak. So I went into surgery and applied for a surgical residency, and was then able to do my surgery again in Detroit at a hospital called Mount Carmel. It was one of the Mercy Health system. Finished up my 5 years of residency training, doing a lot of trauma, of course, there in Detroit, and then had an opportunity to begin my practice up in Big Rapids. Nothing was for me right here in Grand Rapids, and so we were up in Big Rapids for the first 5 years, and then had the opportunity then, after a while, saying, gee, I would like to get involved in education, I'd like to get involved in doing more things, I would like to use my trauma experience, and had the opportunity then to move in with a couple of the surgeons down here, and I've been here ever since. As a general surgeon, one does a lot of things, and that's where the term general surgeon comes in. I've seen a lot of different changes that have occurred. We've had the laparoscopic revolution in general surgery, where we used to use larger incisions to take out gallbladders, and now we use the scoping type of techniques, and that's had a wide application of many things. So I've seen my practice change tremendously over the course of the years. I stopped doing trauma about 10 years ago, and actually have begun to emphasize doing more head and neck types of surgery. And while I'm still doing the usual things that a general surgeon would do, such as gallbladders, hernias, appendix, bowel obstruction, perforated bowel, these kinds of things, I've emphasized in my practice doing thyroid and parathyroid surgery. And I've had the opportunity to work with 3 of the endocrinologists in the area that have been associated with MMPC. Now, most recently, we're associated with Spectrum Health Medical Group, and have developed a good working relationship with them in doing those kinds of surgeries. I've mentioned the Spectrum Health Medical Group, and up until recently, I have been associated with MMPC. And so for the past 10 to 12 years, I've been part of that corporation. We've worked with Spectrum Health very closely over those years, and it only made sense that as the Spectrum Health system was developing a medical group, a group of physicians to work more closely with, that we of MMPC should join. And that's what we did. And so now we're part of the Spectrum Health Medical Group, which improves our ability to give healthcare delivery to our patients in a more efficient manner, working with the changes that are occurring in healthcare delivery that we're all seeing more closely. And there's a lot of changes that are going to go on, and I think working more closely with the system makes a lot of sense. When you come to my office, however, you're not going to see necessarily a corporate kind of look. We hope that you will be seeing caring and efficient people as we've always been over the years. So if you're looking at this video right now, I expect that probably you're going to be coming to see me. I look forward to meeting you. Thank you.